I grew up in a very supportive, loving, two-family household and always had a place to call home, always a place to go to. Unfortunately, I found myself in California and then in Las Vegas, about 1,700 miles away from that place that I called home. The experience of not having a place was, certainly a reality that I was not yet ready for. I guess the turning point was I overdosed and was hit with about 9 shots of Narcan. The facial expression on the EMS was one of shock and disbelief that I was still there. I was lost, but I knew one thing for sure. I didn't want to die. So that was the last time that I used heroin. I did find myself back to St. Louis in a supportive recovery housing model that gave me the opportunity to start to try to find something different.
Our journey together inspired us to start Haven and offer housing and different types of services for those individuals experiencing mental health and substance use disorders. Haven strives to serve individuals who are really at that intersection, experiencing substance use, homelessness, and mental illness. Our approach to housing is different than what we had traditionally seen in our region and across the country because we have really tried to focus on, one, a continuum within our network, and then working really diligently to create strong community partnerships as well. Working with local government, state government, even some of our federal partners to really make sure that we're in alignment with other groups that we know have a similar focus. It's not just us, right? It's all of St. Louis, all of Missouri, all of the region working together to try to make sure that all the services that they need are provided.
Our journey in the beginning had always been to bring something different to the table, to be solution-oriented, to be, client-driven.
We want them to be able to grow and hopefully live life just independently and be thriving when they're finished with our services or stay with us long term. I think our first year budget was $17,000 and we served 23 people. And so we have grown tremendously since then, and last year served just over 330. And so in total we've housed well over 1,000, I think over 1,300 at this point, and served over 5,000 through different services. The impact that we're having or that we're seeing are roughly an 85% reduction in substance use. We've also seen a 94% reduction in homelessness. And so we're really able to get people plugged into different types of housing or levels of care that they may need. We've seen anywhere from 50 to 75% reduction in nervousness, hopelessness, and then an increase in feeling a sense of community, being connected to their family, feeling that they are empowered to make decisions for themselves, and also feeling connected to long-term services.
Over the year and a half, 2 years, just the overwhelming outpour of support just to align with, our visions and, to bring that collaborativeness together, I see nothing but growth in the future. We're open for change. We're open for community partners, and we can't stress that enough. It's definitely heart-centered, and we have a lot of stake in the game.
The goal is to serve people well and help change the system enough that people can live and thrive independently. We're not going anywhere. We want to stay and we want to help, and this is our home and this is where we want to serve people. I'm Callum Montgomery.
Trent Montgomery, and we're founders of Haven Recovery Homes.